Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about how somebody experiencing hip pain can try repeated specific movements in order to try to reduce that pain and improve their mobility. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I make. So the method I'm going to be talking about today is something called the McKenzie method. And essentially what the McKenzie method is, it's a technique in which we use repeated movements in order to first localize or centralize pain, and then to ideally abolish it if we're going in the correct direction. And so there's a specific sequence of movements that you want to perform, particularly when treating the hip. And again, this can be used for back, for neck, for upper extremity. So I'm going to just be talking about from a hip perspective. So what I see in a lot of cases, right, with a lot of hips is an overuse of the muscles in the front of the pelvis. So in a lot of cases, right, what we'll find is a reduction in terms of glute strength, right? So buttock strength with people who have hip pain. So in particular, it's called your glute medius muscle. So in a lot of cases, right, there tends to be an overuse of whether it's psoas, quads, TFL, which is a muscle that attaches onto your IT band. There tends to be an overuse of these muscles in a lot of cases, and it creates all sorts of biomechanical issues in terms of how somebody might walk. And so with the McKenzie method, right, the first movement, so to speak, that's suggested in terms of helping to localize pain and reduce it, again, and try to centralize it, is what's referred to as repeated hip extension. So this would be one of the exercises you would try as a starting point to see what happens after you do these repeated movements, what happens with the functional movement that was causing the individual pain. And so what you do here, I'm going to actually show you from the side. You would go, so if this is my affected side, right, my right side here, I'm going to place my hand just in the back hip region, right? And what I'm going to do here is I'm going to repeat extending the hip forward and pushing forward. So the movement looks like this. And I'm going to continue to repeat in this position here. So as I'm doing this, what I'm monitoring is, number one, what's happening to my pain, right? So is my pain reducing? Is it changing locations, right? So if they are, well, these are all good signs. That means I would actually continue with this movement, and then after I've repeated typically about 10 to 15 times, I would then retry whatever the position or movement is that was causing me pain before. So that might be a squat, that might be going up and down stairs perhaps. So you'd actually want to repeat the functional movement. Now the other thing you might find is that the pain goes, but I'm still stiff. Okay, so if there's still a restriction in terms of movement, hey, I'm going to repeat. Right? I'm going to go into that stiffness, and I might actually be more aggressive if my pain is gone, right? So I can push into it more. You really want to be aware of pain when you're doing these exercises, but if it moves from a painful sensation to more of a just a restriction in movement, you can then push into it. Following that, so if I found that, okay, extensions have got me so far, I'm still limited in certain positions. The next thing that you might attempt then is some flexion, some repeated flexion. So what this looks like is you would sit on a chair, okay, you'd hold on to the knee, and then I'm going to basically go into this repeated flexion movement in through the hip. And then I'm going to monitor the same thing, right? So what's happening ideally at this point, right? The pain will have subsided. I might still be restricted in certain movements. So the hope, right, is that that extension movement, that repeated extension, helped to abolish the pain. Now I'm just feeling some restrictions in other areas. So then I'm going to repeat this. You might find that, hey, just after the repeated extension, all my movement's better. In that case, just stick with the extensions, right? No need to even repeat flexion. But in a lot of cases, again, the pain might have gone, but there might be some restrictions in other hip positions. And so that's why we would then include the flexion after, repeated flexion. And again, I'm sort of leaning back, right, when I do this, and I'm bringing that knee up towards the chest. I'm repeating this, and I'm getting a good stretch in the posterior capsule of the hip, so to speak, which again should help to regain certain positions, certain movements, so to speak, in through the hip. And then from there, right, again, let's assume that actually I'll use the chair again. Let's assume that I'm still a little bit stiff, particularly in maybe external rotation in through the hip, which is quite common when there's a hip issue. So let's assume, hey, I've got some more hip extension. My flexion's gotten better, but I'm still a little bit stuck in terms of my rotational movement. So from there, right, what I would do is actually put I'd cross my one leg over, and now, hey, what am I doing here? I'm repeating, right, into a external rotation position here and through the hip. And I'm going to continue to repeat. Pressure on, pressure on. Now, ideally, again, I'm not increasing pain, but I'm going into my restriction with this movement. And again, it's going to be pressure on and pressure off. And then typically, right, you'd actually want to finish off by doing the first exercise that we did. So repeated extensions, the one that ideally would have helped take away the pain. This is, again, just sort of a typical patient dynamic that we might see in terms of the restrictions, in terms of like ideal pain response, but everyone's slightly different, and that's why you want to really monitor what happens to the pain. Does it move? Does it centralize? Does it change positions? Is it getting better? Is it getting worse? If it's getting worse, you don't want to repeat that movement. If it's getting better and I'm just feeling stiff, move into it. Please please check with a physiotherapist to make sure that this exercise is appropriate for your specific hip pain. And thanks again for watching. Have a great day. Take care.